My name is Diane Tibbert, and this is my strategic plan to increase nursing leadership effectiveness and communication in the intensive care units. Lack of effective leadership and poor communication can cause increases in stress among healthcare providers, and this increases the potential for error. Implementing ways to ensure that strong leadership and the associated effective communication skills become standard practice within the pediatric intensive care unit will require the use of this strategic plan. For nurses in the intensive care unit to deliver the best possible patient care, nurses need to be able to have effective communication skills. This is a significant factor in determining successful patient outcomes. Also, research has found that supportive and effective nursing leadership directly affects patient outcomes in a positive manner. Supportive leadership has been shown to increase patient satisfaction, decrease medication errors, and decrease hospital-acquired infections. Creating a SWOT analysis is the first step in strategic planning. The SWOT analysis evaluates an organization to help identify its strengths, weaknesses, opportunities, and threats in order to determine internal or external factors that can affect the organization. For opportunities, the hospital has funding for the intensive care unit that is based on several things, including charitable donations. For example, a $50 million donation tying the hospital's largest was made to help create a new clinical building. The new clinical building will allow the hospital the ability to care for significantly more intensive care unit patients and decrease the instances where the hospital has to turn patients away. This influx of new patients is the reason for the strategic plan, as more staff will be required to care for these critically ill patients, and nursing leadership and communications will have to improve in order to support these new staff members. The identified area suffers from a lack of effective leadership and effective communication. It also has been outperformed by other hospital intensive care units in preventing infection and in 30-day survival rates for more complicated procedures. Instituting better leadership practices and improving communication skills can help manage these important patient care issues. This information will help the organization determine the appropriate steps to achieve the strategic plan. The most effective decision-making method for this project is an analytical decision-making model that allows for appropriate decision-making by ensuring that all relevant information is available prior to the actual decision. This particular strategy is systemic and encompasses several steps that are used to arrive at the decision. The advantage of this strategy is that the information that is used to make the decision is objective, and it allows the manager to break down a very involved decision to a more manageable situation. This approach is ideal for this project as the project itself has simple and explicit goals, the team has access to all the information it needs, and can decide which information is relevant and which is not. All of these concerns lend themselves to an analytical decision-making model. Implementing the action plan requires several steps and almost requires a plan of its own. One strategy that will be used for implementation is to create different versions of the action plan depending on the specific team involved with the plan. This allows managers from different groups to tailor plan implementation for their particular group. Another strategy is to require a checklist that managers can utilize to ensure that implementation remains on track. One important tactic to institute is a performance management and reward system to encourage employee buy-in and sustainability. This is of particular importance in this project because changing leadership behaviors will need some form of performance management and behavior reinforcement. Lastly, initiating monthly planning meetings and annual review dates where specific progress related to changing leadership behaviors will be discussed. These strategies will be important to the successful implementation of the action plan. One way to ensure the success of the action plan is to include cross-functional collaboration. Using team members from different areas in the organization that have different experiences can bring a unique perspective to the implementation of this project. Cross-functional teams can not only assist with implementation, but also with identifying quality control issues and create improvements throughout the organization. In order for cross-functional teams to function within this action plan, leadership will have to create diverse teams, including implementation team members of different ages, experiences, skills, seniority, and departments will allow the team to evaluate potential problems from different perspectives and create solutions to these problems. For this action plan to have the desired effect, it is imperative that there is a collaboration between team members, managers, and leaders. This requires a leadership strategy that focuses on collaboration. The communication plan is one of the most important parts of strategic planning, as ensuring effective communications will play a huge role in the success of this project. Also, an effective communication plan should include which communication conduits will be used to obtain feedback. The strategy this plan will use is active listening. This is an important step in effective communication and focuses on the listener making an effort to listen and absorb what is being said. This will allow the speaker to feel that what he is saying is important and appreciated, and also keeps the listener on point and able to make a relevant contribution to the conversation. This plan will include using both formal and informal communication channels that will ensure that all members of the organization have all of the information they need to accomplish their tasks. Formal communications are usually hierarchical in nature, as leaders or managers have the responsibility for instituting and maintaining formal communication channels. This type of communication is an official conduit where information flows from person to person to make certain that the goals of the organization are being accomplished. For the strategic plan that focuses on increasing the effectiveness of both nursing and leadership and communication to succeed, leaders will initiate meetings every 2 weeks to discuss both the action plan and the communication plan. Informal communications that are not official and may be considered rumor or gossip are otherwise known as the grapevine. This type of communication can be detrimental to a project if leaders do not take this opportunity to create buy-in. Leaders will use champions within the intensive care unit to help employees buy into the action plan by educating the champions about the plan and its benefit. Leadership and managerial skills will be imperative in implementing the strategic plan, as the best way to improve leadership and communication is to model these behaviors. The strategy leaders will use is integrity, as they will need to lead by example. Leaders will need to make sure that they are practicing the leadership skills they are looking to improve in their followers, as their followers will be watching closely. In conclusion, the Joint Commission on Accreditation of Healthcare Organizations describes communication error as the cause of 60 to 70% of preventable hospital deaths. Communication errors arise when crucial patient information is wrong, missing, misinterpreted, or not appreciated. Communications are considered the most common cause of medical error and should be largely preventable by well-designed procedural policies and good communication. Professional communication among healthcare providers is a complex topic that is analogous to critical communications as practiced by other healthcare professions. In addition, there are unique aspects to medical communication, including compassion, privacy, and the rich cultural heritage of medicine. Physicians and all healthcare providers can learn a lot from other high-risk professions with regard to good communication and avoidance of common communication pitfalls. To avoid these communication errors and increase the quality of patient care within the intensive care unit, the strategic plan of increasing nursing leadership and communication effectiveness in the intensive care unit will increase collegiality among employees and leaders, will decrease instances of miscommunication and patient error, and it will increase the quality of patient care throughout the organization. Thank you, and Articles that have been referenced within this presentation will be available to you.